Rapid Rhino is a nasal tamponade device that is specifically designed to address the major challenges in the management of epistaxis.
My original experience with the Rapid Rhino product line came during my residency, and what really set it apart at the time was the hemostatic knit, distinguishing it from its competitors on the market, and the fact that it has a high volume, low pressure cuff. And I made sure that as I transitioned into the private practice world that I had it available to very successfully control nosebleeds as well.
This device features a high volume, low pressure tamponade that allows gentle conformity of the balloon to the nasal anatomy upon inflation. This balloon feature also decreases the risk of pressure necrosis and will effectively stop the epistaxis at the source of the bleed. Rapid Rhino also offers the benefit of hemostasis. The tamponade cuff is wrapped in a hemostatic knit. Water activates the carboxymethylcellulose, turning the dry fabric into a slick and cooling gel for platelet aggregation. Rapid Rhino is designed with a pilot cuff which remains external to the nose to allow for constant tactile feedback as the internal tamponade inflates. The nasal anatomy is highly vascular and also has several vulnerable regions that are prone to bleeding. Anterior bleed most often originates in the rich arterial anastomoses, known as Kesselbach's plexus. This is characteristically prone to epistaxis. Roughly 90% of all nosebleeds originate here. Posterior epistaxis generally arises from the posterior nasal cavity via branches of the sphenopalatine arteries. Such bleeding usually occurs behind the posterior portion of the middle turbinate or at the posterior superior roof of the nasal cavity.
When individuals have failed conservative measures, and certainly there are some increased risk factors for that. You've attempted to control the hypertension and you've been unsuccessful. The geriatric patient who's anticoagulated during the drier winter months, these are the patients who, no matter what you do in terms of controlling their blood pressure, etc., are going to have that bleed and require a pack.
Options to pack the nose include ribbon gauze dipped in Vaseline. This method is placed in the patient's nose with bayonet forceps and is often painful for the patient and labor-intensive for the physician. Mirocell is a market leader for epistaxis packing. Though efficacious in many cases, it is among the most painful measure for ending a nosebleed and does not offer any hemostatic benefit. Rhino Rocket is similar to Mirocell in that it's a method of absorbing to end a nosebleed, is quite painful, and often disrupts freshly formed clots upon removal. Rapid Rhino addresses most, if not all, of the challenges in the management of epistaxis. Remove the device from the envelope package along with the removal of the light blue plastic tube encasing. Thoroughly saturate the Rapid Rhino in sterile water by submerging the product for at least a full 30 seconds to allow the hydrocolloid fabric to convert entirely into the lubricious and comfortable carboxymethylcellulose gel. Insert the Rapid Rhino nasal tamponade into the patient's nostril parallel to the septal floor or following along the superior aspect of the hard palate. If there seems to be some resistance upon insertion, simply remove and reinsert, ensuring the device is positioned such that it is pushed into the face level to the palate, as opposed to up the nose at a 45-degree angle. Gently insert the device until the blue indicator ring is just inside the opening of the nostril. Using a 20 cc syringe, slowly inflate the balloon inside the patient's nose. The balloon will conform to the nasal anatomy. The CMC hydrocolloid gel acts as a platelet aggregator, teaming with the gentle tamponade to stop the bleed at the source. Use the pilot cuff as you would on an endotracheal tube to monitor the intranasal pressure as you inflate. It should be taut but not hard. The specific amount of air to inflate will depend on the anatomy of each patient, so be sure to use the pilot cuff to monitor. When there is sufficient pressure, allow the patient to sit for 5 to 10 minutes prior to discharge. Swelling in the nasal anatomy will reduce, and the balloon may need to be inflated more to avoid movement of the device. After this second assessment, tape the plastic butterfly to the patient's cheek for discharge. The patient may come back 24 to 72 hours later for removal of the device, or they may see an ENT specialist for follow-up. Rapid Rhino has a unique design that will effectively stop epistaxis the first time and is more comfortable for patients upon insertion and removal than other packing options.